Hello, welcome back to my channel. I hope you're doing good and staying safe during the pandemic. So recently, a lot of countries announced that the vaccines are made available for people above the age of 18, which is fantastic, giving us hope that we might be nearing the end of pandemic. Now, this being said, it is important for us to know certain things about the vaccine before getting them. Well, I'm not talking about the way vaccines work, it is more about the things you've got to look out for before and after getting vaccinated. Especially when you're given a choice to select your own vaccine, you should be able to make the right decision based on what is suitable for you. And this video is created in order to help you throughout the vaccination process in a smooth manner. So today, we'll be talking about two important vaccines which is available in India right now. One is Covishield or the Oxford AstraZeneca vaccine and covaxin, which is produced by Bharat Biotech. We'll talk about who should not get the vaccine so that you might know if you are an eligible candidate or not. And then about the side effects of the vaccines. Well, there are similar side effects for both vaccines, but also there are some side effects which is particular to a vaccine, and it is important for you to know them in order to not freak out in the last minute. And finally, when you should go to a doctor after getting vaccinated. There are certain symptoms that you'll have to look out for, and you have to give it immediate medical attention. And if you're not giving it, it might become worse. So it is important for you to know when to go to a doctor, irrespective of the symptoms you're having. That is all we're going to talk about in today's video. Okay, so who should not get the vaccine? This is a common list for both the vaccines, Covishield and covaxin, which we'll be discussing right now. If you fall under any of this category, please do not take the vaccine. Or even if you're in this category and if you feel that you have high risk of getting a corona infection, you want to get the vaccine, then it's better you go to a doctor, get their advice, and then take the vaccine. Pregnant and lactating women should not get the vaccine because till now we don't have enough of research and results saying that the vaccine is safe for them. Maybe in future we'll know if they can get vaccinated, but as of now we don't know the risk associated with it, so do not take it. The second category of people are the ones who are suffering from acute infection or fever. So if you're already ill, do not take the vaccine because when you're not feeling well, your immune system is already working on making you better. It is fighting against something, and taking a vaccine is going to make the conditions worse rather than actually helping you fight the final COVID infection. If you are allergic to any of the ingredients of the vaccine, do not take it. Over here, I have given you the ingredients of both Covishield and covaxin. You can go through it, and if you're allergic to anything, please do not take the respective vaccine because it might cause severe allergic reactions and that might be an issue to you. So that was the eligibility test for both the vaccines, covaxin and Covishield. And if you are planning to take covaxin, there is another set of lists you have to pass. Number one is people who are under anticoagulants. So if you are taking any of the anticoagulants I have mentioned over here, and you have to check for your INR. If your INR is above the upper threshold, if your INR is high, then please do consult your doctor before taking the vaccine. People who are having certain medical conditions, they are under blood thinners. So if you are under blood thinners, please do consult your doctor before getting the vaccine. Mostly patients who are having high risk of heart attack or blood clotting or stroke are given these sort of medicines. Even if you're having some heart conditions, it is given. So do check with your doctor if you are under any of these categories before going for the vaccination process. Immunocompromised individuals. These are the people who are suffering from autoimmune diseases or AIDS and certain diseases which is actually having a weak immune system. In that case, it is better you consult a doctor before getting the vaccine. So that's about the eligibility of the vaccines. So if you do not fall under any of these categories for the respective vaccines, then you can go forward by getting a vaccine. So coming to the side effects of the vaccines, once you get vaccinated, these are the common side effects for both covaxin and Covishield. Irrespective of it, these side effects can be observed. That is severe pain at the site of injection, redness, swelling over there, and then fever, it is common. Even cough, cold, these are symptoms of the vaccination only. And also certain people are allergic. They do get some allergy, but just make sure it is not severe. Until it's severe, you don't have to worry about it. It is a normal side effect. Even people have nausea, people vomit after vaccines. These are all nothing to worry about. This is all just ensuring you that your immune system has started working to fight against the real coronavirus. Your body is going exactly how we planned it to go. Those were the common side effects of the vaccines, which was being published in the fact sheets of both the companies which is producing the vaccine. Okay. Now, apart from this, in case of Covishield, which is also known as the Oxford AstraZeneca vaccine, there has been a lot of speculations and information about the blood clotting as a side effect. Now, I want you to know that this is also a side effect of Covishield, but the chances of getting a blood clot is very rare. It is like 0.01 percentage. 1 in 1 lakh people who are getting vaccinated might have this blood clot. It is very rare. But it is important for us to know how this blood clot is formed, or to know if that a blood clot is being formed. You can diagnose it early and get it treated in the beginning itself. And these are the things which is telling you that if you are getting a blood clot or not. So finally, when should you go to a doctor after getting vaccinated? If your side effects are severe, then you have to go to a doctor, especially when you're having fever and severe body ache and all. After taking Covishield, you can take paracetamol to symptomatically treat it. But you'll have to go to a doctor if the pain or redness in that particular injected area stays for more than 2 days. In that case, you have to go for a doctor. And also, if you're having an anaphylaxis reaction, anaphylaxis is severe allergy. Now, allergic reaction is a common side effect, but if the allergy is severe, then please get it treated. And also, if you feel that the symptoms or the side effects is prolonging for a long period of time, if you do not feel comfortable with it, then go to a doctor and get it checked. So that's all about vaccination you had to know before getting it. I hope this video was helpful. Please do share it with your friends and family if you found it interesting. Let's not forget, the pandemic is not over yet. Please do wear your mask, get vaccinated, and let's come to an end with this pandemic very soon, hopefully.